Hello and welcome back to Healthy Bee. Today's topic, risk factors for serious health conditions. We all strive for good health, but sometimes, our daily habits and lifestyle choices can put us at risk for serious health conditions. From poor diet to sedentary lifestyles, there are several risk factors that can contribute to the development of various diseases. In this video, we'll be discussing these risk factors in detail and how you can reduce your risk of developing serious health conditions. So, let's get started. 1. Poor diet. One of the biggest risk factors for serious health conditions is a poor diet. A diet high in processed foods, sugar, and unhealthy fats can contribute to the development of various diseases, including obesity, type 2 diabetes, heart disease, and cancer. Eating a diet that is high in simple carbohydrates and sugar can lead to spikes in insulin levels, which can cause insulin resistance and prevent the hormone from managing your blood sugar properly. This can lead to weight gain and eventually, obesity. Additionally, consuming a diet that is high in unhealthy fats, such as trans fats, can increase your risk of heart disease. Trans fats can raise your LDL cholesterol levels and lower your HDL cholesterol levels, which can increase your risk of heart disease. Furthermore, a diet high in processed foods can contribute to inflammation in the body, which has been linked to a variety of serious health conditions, including cancer and heart disease. 2. Sedentary lifestyle. Another major risk factor for serious health conditions is a sedentary lifestyle. A lack of physical activity can contribute to the development of various diseases, including heart disease, type 2 diabetes, and obesity. When we are sedentary, our bodies do not get the exercise they need to maintain good health. This can lead to a decrease in muscle mass, which can make it more difficult for our bodies to regulate blood sugar and burn fat. Additionally, sitting for long periods of time can increase our risk of heart disease and stroke. This is because when we are sitting, our blood can pool in our legs, which can increase our risk of blood clots. Furthermore, a sedentary lifestyle can also contribute to a decrease in insulin sensitivity, which can increase your risk of developing type 2 diabetes. 3. Stress. Stress is another major risk factor for serious health conditions. Chronic stress can contribute to the development of various diseases, including heart disease, depression, and anxiety. When we are under stress, our bodies produce cortisol, a stress hormone. Cortisol can increase our blood pressure, heart rate, and levels of sugar in the blood, which can increase our risk of heart disease. Furthermore, chronic stress can also contribute to the development of depression and anxiety. When we are under stress, our bodies produce less serotonin, which is a hormone that helps regulate our mood. This can lead to feelings of depression and anxiety. Additionally, stress can also contribute to weight gain, which can increase our risk of developing serious health conditions, such as obesity and type 2 diabetes. 4. Sleep deprivation. Sleep deprivation is another major risk factor for serious health conditions. Not getting enough sleep can increase your risk of developing various diseases, including heart disease, depression, and type 2 diabetes. When we are sleep deprived, our bodies produce less leptin, a hormone that helps regulate our appetite. This can increase our risk of overeating and weight gain, which can increase our risk of developing serious health conditions. Additionally, sleep deprivation can also increase our risk of developing depression and anxiety. When we are sleep deprived, our bodies produce less serotonin, which can lead to feelings of depression. 5. Excessive alcohol consumption. Drinking too much alcohol can have serious negative effects on your health. Alcohol is a toxin that can damage many organs in your body, particularly your liver, brain, and heart. In addition to causing acute effects such as impaired judgment and coordination, excessive drinking can also lead to chronic health conditions, such as liver disease, high blood pressure, and certain types of cancer. It's important to understand what constitutes excessive alcohol consumption. According to the Centers for Disease Control and Prevention, CDC, excessive drinking is defined as consuming 8 or more drinks per week for women, and 15 or more drinks per week for men. Binge drinking, which is consuming 4 or more drinks in a single occasion for women, and 5 or more drinks in a single occasion for men, can also have serious negative effects on your health. If you drink alcohol, it's important to do so in moderation. This means keeping your alcohol consumption within the recommended guidelines, which are no more than 1 drink per day for women and no more than 2 drinks per day for men. It's also important to take steps to reduce your risk of harm, such as not drinking and driving, and being aware of the signs of alcohol poisoning. If you find that you're having difficulty controlling your alcohol consumption, or if you're experiencing negative consequences as a result of drinking, it may be a sign of alcohol use disorder. This is a serious medical condition that requires professional treatment. If you think you may have a problem with alcohol, it's important to talk to your healthcare provider or a mental health professional. They can help you assess your alcohol use and provide you with resources and support to reduce your risk of harm. 6. Poor mental health. Mental health is an important component of overall health, and poor mental health can increase your risk of a variety of health problems. When you experience chronic stress, anxiety, depression, or other mental health problems, your body responds by releasing stress hormones that can damage your cells and tissues over time. This can increase your risk of chronic health problems such as heart disease, stroke, and diabetes, and make it harder for your body to fight off illness. There are many factors that can contribute to poor mental health, including genetics, life experiences, and environmental factors. Certain lifestyle choices can also have a negative impact on mental health, such as poor diet, lack of exercise, and substance abuse. It's important to prioritize your mental health and seek professional help if you're experiencing any symptoms of mental health problems, such as persistent sadness, anxiety, or irritability, changes in appetite or sleep, or difficulty concentrating or making decisions. Treatment options for mental health problems include therapy, medication, and lifestyle changes. In addition to seeking professional help, there are many steps you can take to promote good mental health. These include eating a healthy diet, getting regular exercise, practicing stress-reducing activities such as meditation or yoga, and staying connected with friends and family. Taking care of your mental health is an important part of living a healthy, fulfilling life, and can help reduce your risk of a variety of health problems. 7. Age. As we age, our bodies naturally undergo a number of changes that can increase our risk of developing serious health conditions. Some of these changes include a decrease in muscle mass, a decrease in bone density, and a decline in organ function. As we get older, we're also more likely to develop chronic health conditions such as high blood pressure, diabetes, and arthritis. In addition, our immune systems may weaken, making us more susceptible to infections and illnesses. While we can't stop the aging process, there are steps we can take to reduce our risk of age-related health problems. This includes maintaining a healthy diet and regular exercise routine, getting regular checkups and screenings, and staying up to date on recommended vaccinations. It's also important to manage any chronic health conditions you may have, and to seek prompt medical attention if you experience any unusual symptoms or changes in your health. By taking a proactive approach to your health and wellness, you can reduce your risk of age-related health problems and maintain a high quality of life as you age. 8. Genetics. Your genes play a role in your risk of developing certain health conditions. Many health conditions are known to have a genetic component, including heart disease, cancer, and diabetes. Some genetic conditions are also linked to specific health problems. While you can't change your genes, you can take steps to reduce your risk of developing certain health conditions. This includes adopting a healthy lifestyle that includes regular exercise, a healthy diet, and avoiding smoking and excessive alcohol consumption. Regular health checkups and screenings can also help identify potential health problems early on, which can increase your chances of successful treatment. If you have a family history of a specific health condition, it's important to talk to your healthcare provider about your risk and any preventative measures you can take. This may include genetic testing, which can help identify any inherited genetic mutations that may increase your risk of certain health conditions. Overall, while genetics do play a role in your risk of certain health conditions, there are many factors that you can control, such as lifestyle choices and preventative measures. In conclusion, there are multiple risk factors that can contribute to the development of serious health conditions. These risk factors range from modifiable lifestyle choices such as poor diet, lack of exercise, and substance abuse to non-modifiable factors such as age, genetics, and family history. It's important to understand the role that these risk factors play in your overall health and take proactive steps to reduce your risk. Fortunately, there are many effective ways to manage and reduce the impact of these risk factors. By adopting a healthy lifestyle, including regular exercise and a balanced diet, staying up to date on recommended screenings and health checkups, and seeking professional medical advice when needed, you can reduce your risk of developing serious health conditions. If you enjoyed this video, don't forget to subscribe to our channel.